So usually the way the vaccines work, so after the first dose, 3 to 4 weeks after the first dose, the body, the immune system kicks in and it works. But I think the real booster in terms of that strong, robust immunity comes after the second dose. So after the second dose, 3 to 2 weeks after the second dose, you have really good protection, like protections from 80 to 90%, or in some cases above 90% protections. That does help in terms of the spread of the virus. That does help significantly in terms of preventing the hospitalization and eventually deaths. So the more we have that higher level of immunity in community, for example, that is the term we use, community immunity or herd immunity, we are going to put a stop to the spread of these VOCs, and we're going to see less and less impact or outcomes on the hospital, in ICU, in intensive care sort of settings. So the more we have those VOCs addressed by vaccinating the highest number of people, the better it is, and then perhaps we will see the end of this pandemic if we go above 85% in each location for each sort of age group. That will be the end of this pandemic, and also that will be the start of seeing a normal life. So I want to say a few words about the vaccine. So if you guys know that we have quite a basket of vaccine currently available, from messenger RNA, Moderna and Pfizer, to AstraZeneca and now Johnson & Johnson. And we have seen every week, every month, there is a new announcement about different age eligibility and the way these first and second doses are given. So I wanted to say that so far, the messenger RNA, if you got the first dose with the messenger RNA, the Pfizer or Moderna, certainly the recommendation is that you end that with a second dose with the same vaccine. Same is applicable for AstraZeneca and Johnson & Johnson, but in many communities, in many jurisdictions, nationally and internationally, there is a lot of experiments and research going on that how you can mix match vaccine. So in the future, we do see that the stockpile of vaccine available will be quite adequate, and that people would have also a chance to get the second dose very quickly. As of yesterday, those announcement has come. So people who have received first dose can now receive their second dose, certainly subject to various jurisdictions and the vaccine availability in each jurisdiction. So that is one important thing I wanted to say. In future also, it's possible that if you got the first dose of one vaccine, it's pretty possible that you may be offered the second dose of another vaccine. And so there is a lot of clinical trials going on that. So I wanted to touch on that particular important point. So in June and July, we do hope that most of the population, most of the community would have received the first and the second dose. Yesterday's announcement certainly is very exciting that now children on 12 and above would be eligible for vaccine, and the vaccine is perfectly safe in those population. So by June and July and August, if we have covered the adults, the elderly, the grandparents and parents, certainly vaccinating children would guarantee a safer school reopen in the fall or in the summer. So I think that's a very exciting news that perhaps would bring the end of this pandemic even quicker and closer to all of us. So we would be very busy, the communities, the nurses the clinics will be very busy on vaccinating 12-year-old and above, while also providing people the second dose in the adult groups.
So in the coming months, with the age restrictions now being recommended from 12 and up, in the coming months, do we expect to see younger age groups?
Of course. So currently, the announcement from yesterday particularly, the vaccine nationally is being approved for 12-year-old and above. So 16-year-old and above were already approved. So now this gives you more chances and more opportunities to cover those age groups. Certainly trials are underway by Moderna and Pfizer and other vaccines to look at the vaccine rollout in younger children, like children above 2, but also children younger than 2-year-olds is also a possibility. So that is coming, I think, very soon by the fall, that we will be able to offer vaccine to younger children. But certainly it's currently recommended for 12-year-old and above, and many jurisdictions in Saskatchewan will be planning because parents and grandparents, everybody want to see a safer school reopen in every community. And that is the goal, that we want kids back in their in-person learning as safe as quickly as we can. So as you have seen, the vaccine rollout has been expanded to many providers, from the nursing to the drive-through clinics to the pharmacy now. So vaccine will be available through different outlets, and in every jurisdiction, depending upon those availability, the vaccine will be offered through different ways, through pharmacists, through nurses, through public health, and through other ways. As the school rollout proceed, there are already plans under discussion that different options will be explored. For example, there may be mobile clinics, there may be mobile team that will go to the schools and provide that school immunization right in the schools. And of course, it requires a lot of background work, having consent from parents, and having an assessment done for each kid. So that is certainly an option on the table, that there will be mobile team, there will be drive-through, there will be different ways where, depending upon each community capacities. Certainly, when anybody come for a vaccine to a doctor or to a nurse, there's quite a process that the nurses would take them through. So first of all, there's a consent that they have to sign, and there's some checklist that the nurses have to ask some questions about any acute conditions, any chronic conditions, any contraindication, any previous allergies. So these are standard processes that the nurses usually ask people. And depending upon each person unique conditions, the nurses would call, if they would need to, call a doctor or a specialist to just walk through some of their unique condition that would require an expert opinion. So nurses actually do that all the time, and they would call us or call the expert or the specialist if the person is on any particular medication that may impact the vaccine administration. So those sort of standard processes are in place in all settings, including schools.